We all have that one friend, the one who says exactly what's on their mind, no matter what. And that's Sheetal Mars.
That's right. Every week, my friends and I dive into whatever's on my mind: sports, politics, pop culture, even my own struggles, you name it. If I'm thinking about it, we're talking about it.
Unfiltered, unapologetic, and just a little dangerous. Get ready for the wild ride that is Sheetal Weapon. You've been warned.
Hi, everybody. Welcome to Sheetal Weapon. Again, I don't know how you're here. So, to all of our listener, we're sticking with single. I think it might be multiple, but it could be just one person listening to it over and over, and that person has a sickness.
Well, but it could also be just one different person each time.
This is true. They listen to what part of an episode and then go, all right, enough of that. I'm Lethal Sheetal, as you know. This is B.E. Trog. And today we have a special episode. Don't freak out. It's not a clip show. We're not ready for that. But we do have a guest. So you're going to hear a different voice other than just these crazy people. Today we're going to talk about healthcare with a doctor that I've already talked about in episode 2 and already sung his praises. I have Dr. D on the show with us today to talk about healthcare and not talk about how sad he is that he has to deal with us.
Thank you. Thank you for the invitation. Look forward to this podcast. Hopefully, there won't be too many tears.
We're all cried out. We're done.
Just the right amount.
Well, and so I have a question because our first episode talks about names. Both me and my brother have unusual names. And so I'd like for you to introduce yourself, tell us how to say your name, and a little bit about yourself.
Oh, very good. So my name's Dr. Hongfei D. Last name is pronounced D, not Die. I always have a few new patients coming into the office requesting to see a Dr. Die. And I joke with them and I say, well, what in your right mind would you walk into a doctor's office named Dr. Die? You're just like going to a surgeon named Dr. Scar or Dr. Butcher. Probably not a good idea, you know. But yeah, I'm a primary care doc. I'm a private primary care doc here in good old St. Augustine, Florida.
So primary care, what made you choose that? And I speak with all due respect because, for us as Asians with doctor parents, it was neurosurgery or you're not invited back home. So why did you choose primary care or family medicine?
You're absolutely right, because my father was a neurosurgeon. My brother is a neurosurgeon. I guess it starts off.
And you're still invited back home? Please tell us.
It was tumultuous, throughout periods of my life and early career. But as old fashioned as my parents were, they were open minded. And I do still at the family events and dinners once in a while get that little bit of a pushback, like, "Oh, you should have been a surgeon," and something like that. But to each their own. I actually originally wanted to be an Air Force pilot when I was young, and then I got glasses, and then actually died. And then I was like, "Well, what's the next best thing?" So the funny enough, I did come from a generation of physicians. My maternal grandmother was a cardiologist. My paternal grandfather was a general surgeon. Paternal grandmother was an OBGYN. Of course, my father is a neurosurgeon. My mother was a neurologist. And now my brother is a neurosurgeon as well. So the next best thing was, I guess, what we were bred to do was to do medicine. So there was really no other choice outside of that. Why did I choose primary care? Well, I looked at, the short story is I looked at my grandfather's life work-life balance. I looked at my dad's work-life balance. And unfortunately, if you're one of three neurosurgeons in a 250-mile radius, you're not going to have a work-life balance. You wouldn't do the world justice to balance your life and work because the number of people with your skill set is so limited, you know. And I tried it, after medical school. I did do general surgery internship for a year, and I mean, you can talk to any general surgery resident. The status quo was walking into the hospital when it's dark and walking out when it's dark, and that was your life for 3 to 4 years. And I just couldn't do it. You know, vitamin D deficiency wouldn't let me do it. Plus, just the overwhelming depression wouldn't let me do it. So I am very grateful that we do have docs out there that gave away that part of their life to pursue such a sacrifice in their career, but it wasn't for me. And I think in hindsight, I did make the right decision because I felt like I'm more of a personable physician. General surgeon, you don't have to be personable. You don't have to be charismatic. You don't have to, sit there and gain the trust of your patients. Your statistics show it all. I operated on 1,000 procedures. No one died on my table, and they've all been successful. That's who I would go to, not the guy who would talk my ear off. But for internal medicine and primary care and pediatrics and all these specialties that require almost a bond to be formed, you almost need a personality for that. And I felt like, thank God I have that personality.
Let's toot that horn.
Dr.
D is super cool and fun.
But that's why I chose primary care. I just felt like, I love building that continuity care with my patients. I love earning the trust, and it works both ways. And, I love stepping even out of the physician role to being a friend, being a mentor, being an advisor as well. And if I chose a surgical subspecialty, that wouldn't have worked. Half of the time the patient's anesthetized asleep, so.
And they
So
would say
why.
that's the best part.
For some people, that might work.
Yeah.
Doctors come in all different personalities, shapes and sizes and colors. And some docs, you look at them and you're like, oh, I understand why they're a surgeon. I understand why they're a radiologist. I understand why they chose primary. So hopefully, when my patients look at me, they think, oh, okay, I'm glad he chose primary. So.
So I had a question, because you talked about going in when it's dark and coming out when it's dark, and that you had the personality and you wanted to be with patients. And I know a lot of doctors, been around a lot of doctors, grew up around doctors, and I find that there's been a shift over time. When my father was a doctor, let's say 40 years ago when he first started practicing, he could do that. He could get to know somebody. The community could get to know him. And then today, that ability to build a relationship is so hard. I'm wondering how you're able to do that when I don't know any other doctors who are able to do that. At least not today.
Yeah,
Mhm.
I mean, it's a very good question. This is probably going to be the basis of the whole episode, I feel. But times have changed. Um, the physician shortage would be one of the main reasons why, this is becoming a normalcy. You just don't have enough physicians compared to patients. The other main thing that has changed in healthcare over the last 20 to 30 years is the involvement of the insurance companies in reimbursement. You have to meet certain, quality metrics. You have to meet certain billing standards and coding, and your notes have to be on par of what you bill for. So there's definitely more emphasis on health systems and physicians working on being paid accurately than it is to provide, time for the patients as they used to have, because it used to be a 30-minute visit. A doctor would sit there at a table with a clipboard and a piece of paper and give you their undivided attention. And charting would be as simple as, a couple lines or even a paragraph, and that was it. Unfortunately, now you know, f- everyone's in front of a computer and typing almost half a Bible, for every 30-minute visit. And um, you just
30 minutes. And not to interrupt you, I am ever gotten a
Sure.
30-minute visit, except, and I would say this probably twice in my life. There are two doctors that ever gave me that kind of attention. And that was you and one other doctor when I was struggling with my fertility. It was a fertility specialist that I paid out of pocket.
Mhm.
And my brother and I were talking about that. That when I think about the doctors I've had to interact since I've had insurance, and when I was younger, a child, I had my parents. I don't ever remember dealing with insurance. I know we had it because my parents both worked, so they had insurance, but we didn't access the healthcare system. We had doctors at home. So,
If you're
so
not bleeding out of your ear, you're fine.
yes,
Even if you
exactly.
are bleeding out of your ear, you're fine.
But when I think about going from college and getting my own health insurance plan, so I was in my early, mid 20s, and I started going to doctors with insurance. I don't think I ever saw the same doctor twice where they remembered my name.
Right.
And so, and you would wait an hour. You had an appointment, but you were still delayed an hour, and then they would see you for 8 seconds. And if you were lucky, it was a full 5 minutes, and then they were out the door writing scripts and telling you, okay, schedule a follow up. And that was it. And you went back in a month and they didn't know who you were. And they're like, let me look you up and see what I said about you last time. And so that's what I've noticed about the system, and how, like, you can't build a relationship. I wouldn't even remember the name to develop a relationship with them because you spend so little time. So when you're talking about a 30-minute visit, like, who's getting these 30-minute visits? Where do I go to get a
Well,
30-minute visit?
well, you wouldn't know, but sometimes with your follow-ups, you might be allotted 30 minutes. But by the time you're taken in, if your doctor wasn't running late, which most doctors are, by the time you're taking in, that's 10 minutes into your 30 that's gone. And then your nurse has to get you in, or medical assistant brings you in. They're in front of a computer typing in vitals and stuff. There goes another 5 minutes. And then your doctor comes in and he's sitting in front of the computer knowing that he has to either type this up inside the visit, or he would have to take time out of his normal life when he gets home with the kids and the wife, finally, putting the kids down at night to open up his computer again to catch up on these things. So if that doctor chooses to type in the office, and let's say he's a slow typer, I mean, there you really get 10 minutes of that 30-minute visit. And this is why majority of the folks feel like they got 5 to 10 minutes, because even though you're allotted time doesn't mean you're going to get it, you know. And like I said prior, I think it's a multifactorial thing. I think the whole healthcare industry right now definitely needs some reform. But one of the ways I was able to get out of it, and really practice medicine, I feel like the way it should be done, is I left it. I just couldn't see myself happy anymore. Treating patients like a number without opening my computer. I really don't know what their name is, because I'm seeing, an average primary care doctor has 2,000 to 3,000 patients. So you're going to try to remember every single one of them, and then the only chance you have to really understand your patients is chart review, right? But you start the day at 7:30. So unless you wake up at 3 o'clock or 4 o'clock reviewing your whole day, you're going to rely on that medical record to know your name, to know why you were here last time, to to catch up on your needs and anticipate your treatment plan. No, if that's the case, if you're going to add that burden on a primary care doc and add on the burden about charting and billing correctly so the health system can get reimbursed, when are they ever going to sleep? When are they ever going to spend time with their family? So one of the ways I got out was I left the corporate healthcare system. I started my own private practice. It's called direct primary care, and all that basically means is it's a traditional shack and shingles practice. No insurance company. I take a monthly membership. I cut the middleman out, and my patients get my full undivided attention whenever they need it, and they never feel rushed, and I never feel rushed either. So that was my safety net, was to get out and do it on my own.
So when did you, and like obviously, you worked in the system. Did the system change at all? Was there ever a time where it was better, or was it always like this?
I think it had its golden years. Unfortunately, I was born into this system, more or less, as many doctors are. I would say, based on what I hear from the old docs, and you can go interview any doctor in their 50s and 60s, and just ask them a very simple question: is, did you like practicing medicine today, or did you like it more 30 years ago? And I think unanimously, every single doctor that worked during that timeline would choose 30 years ago. So that's why I think, yeah, medicine was probably better, 20 to 30 years ago, even 40 years ago.
Well, so and if you read or any of the news, they say, well, doctors back then could do whatever they want. They were overbilling, overprescribing. I mean, the opioid epidemic started during that time. Um, there was a lot of unscrupulousness, and so we required all this regulation. We required all this noting and charting because there was so much inconsistency in care and people just getting, you know, I think the argument was too much care, right? Like, let's
Right.
just give pills and surgeries to everybody because now we can make as much money as we want. And so, if you're from the system looking at that statement, you would go, well, yeah, of course they liked it better. They were making bank, and
Sure.
now they can't. So we're protecting the patient from those unscrupulous doctors.
Sure. There's always a bad apple in the bunch, and that's with any business. I think history tends to repeat itself. I think whenever there's a lack of preparation, whenever there's a lack of regulation, the response is overregulation. Whenever there's a period of misdiagnosis and underdiagnosis, it's followed by a period of overdiagnosis. I think that the right thing is somewhere in the middle. And unfortunately, we're not good at stopping in the middle. We're good at overshooting it and then having to fix it and adjust it again. So I agree with you. At that time, probably wasn't the most regulated. Opioid pandemic did happen, and doctors did make a lot of money and profit, but they also had a lot of decision making and autonomy in their practice as well, and was able to get patients in, was able to provide them with the time they need. That being said, true, I guess doctors aren't making as much as they used to, trajectory wise, but healthcare administrations are making bank now. Insurance companies are making bank now. Hospitals are making bank now. So out of all those things, you really need doctors. So why aren't doctors' salaries catching up to the growth of all the revenues of these other ones? I think, if anything, physician salaries should be increased because they're doing the work. You know, so yeah, there's ups and downs with every period. Um, I think a lot of doctors nowadays crave autonomy, which have long gone, and I do believe that overwhelming majority of physicians are in it for the right reasons. Regulation is needed, but I think overregulation is how we got to this point. You know, But that's just my 2
No,
cents.
and
You
I
know?
see it because when I think about my father, my brother, and my mother who got her PhD in healthcare administration, and we were talking about this, and my father would say, I just want to be a doctor. So much of his career, he was pushed to be an administrator. When you're a really great doctor, a lot of times you'll get pushed to go the admin track and start managing other doctors or managing the system. And he already always crashed out of that because he just wanted to be a doctor. And you take someone like that who says that in the 90s, and then you take someone like my brother today who would say, "Yeah, I just want to be a doctor. I love the medicine." It's similar to school teachers too, right?
Mhm.
They love the teaching. They don't like the bureaucracy around it. They don't like the culture around it. If it was just up to, even with the low pay, if they could just be teachers and be allowed to be there for their students, you would have a lot more teachers even at today's pay rates.
Right.
But it's because of all the nonsense that job is packaged in now,
Mhm.
it makes people hate their job. And so teachers leave, but for medicine, a lot of times you're the sole breadwinner. And if you're not, your spouse typically will take a second place and not be as high as you just because there's kids and other things
Mhm.
involved.
Mhm.
So now you can't just leave because there's a lot, like, what else are you going to do? You can
Right.
leave to go to another system, but you can't just leave. And I find it interesting that you left and without, and I don't know if you're the only breadwinner in your family, but that you took the security of the system and all that that provides, whether that's healthcare or um, benefits or the pay, and said it's still not worth it.
Yeah, it was uh, what you just said has been looping around in my head for about 5 years before I decided to take this leap. You know, and you're absolutely right. The main reason was I did weigh the benefits and cons, the pros and cons. I did weigh many factors, but at the end of the day, the deciding factor was simply have if I continue down this road, would I continue being a physician or would I go work at Home Depot and be a manager of a Home Depot?
My
And
brother says he wants to dig ditches. Like, if you were
I'm,
leaving, he just wants solitude and to just dig ditches.
because at the end of the day, you know, to have those two different careers line up together and be,
Hmm.
to even consider that means you need change. There's did not go to school for the prime of your life to consider going to Home Depot because the current healthcare system's burning you out. You know, burning you out in many ways. Making you feel taking away your autonomy as a physician, making you feel that you're almost in a factory assembly line, just pushing patients in and out, a numbers game, making you feel insignificant, even though you have probably, you're the 1% of the populations that gave up, your prime to get all this education done, but now you're being oversight by some 25-year-old that's fresh out of business school. I mean, there's a lot of reasons that physicians are unhappy. And for me, it was just, yeah, I can continue another year of this, but there's no way I'll continue another 5 years of this. You know, so you're absolutely right. Financially, may not have been the best decision I made, but I mean, I took all my retirement out and put it into this, and but within a month of starting it, my whole mentality of my career has changed. I enjoy coming to work. I enjoy going home. I enjoy being able to spend time with my patients. And I told my spouse from the beginning, and I told her I don't care if I have to work 3 times as hard with this business endeavor and bring home the same exact salary, I would be still more happy doing this than working for a health system. And that should speak monuments, you know. Um, because even though you're working hard, you get to practice medicine the way you were trained. You get to make the decisions, not based on what the insurance companies feel, not based on what the MBA, administrator on top of you feels.
Hey, we're
But
nice people.
Sometimes.
true, true. But you know, your brain, the administrators' brains don't function as a physician's, right? The physician's brain functions as what can I do for the patient? What can I do to heal them? What can I do to make them better? The the administrator's role is how can I squeeze more profit, more efficiency? Um, how can I make more profit to expand and give more? And I do agree, provide more care to more of the public. And now I have to wear both hats. So even though you'll see in this episode, I trash a lot of healthcare administration. I don't want to wear their hat either. Nothing's perfect, but
I was going to ask you because now you're both the doctor and the business person. You have a practice you have to maintain. And part of that is getting patients in the door. That part of that is, okay, you have to, what's the difference between having 1,000 patients under your practice paying you or 1,500? Do you squeeze in another? Do you ever say no? Because if you say no, that's the difference between paying your light bill or not paying your light bill.
right. Yeah, that's definitely continuously circling in my head every single day. I'm just reassured that I have the power to make that decision. If I want to, and you've met my office manager, my nurse Alexis. We butt heads on a daily basis because she thinks I'm too kind, and I don't put I put my physician hat on more than my MBA, my business hat on. And at the end of the day, my rebuttal for her is, are we homeless? Are we gonna get homeless if we eat the cost again? If we, prioritize the patient over getting reimbursed? Are we gonna be homeless? And if the answer is no, then I literally tell her, who gives a shit? If this decision I'm making right now doesn't shut our lights off, then it's the right decision. Because, and we talked about this earlier, because I do think it's all going to come back, um, in the cosmic wash. I do think one of the reasons I enjoy my practice more is because I can be a physician over a businessman. And I do hope to keep that, you know, I hope I do keep that mentality for longer than I can.
Well, as you know, we're trying, I always sing your praises, but and there are doctors whose praises I sing. I know good ones. I know a lot that say the same thing you're saying. Hospitalists, people are in the system. Again, they for whatever reason they can't or won't make the leap to make the change, but they're as frustrated as you. And but speaking as a patient, so I kind of want to play devil's advocate a little bit.
Sure.
Is the doctors that I've interacted with, very few and far between are the ones that exhibit any amount of care when I walk in the room. So it's one of those things, okay, put your doctor hat on, at least when you're in front of me.
Right.
And so it's kind of a chicken or the egg question. Did doctors get apathetic and now they've got business hat on all the time? They're just billing because at this point, what difference does it make? Or did the system make them that way, such that that's the kind of, because I would have the argument more care isn't necessarily better. A lot more facilities with the same doctors that treat you just like a number, that misdiagnose you, underdiagnose you,
Right. Right.
dismiss what you're saying over and over and over again. You know, they say on average it takes 7 years to diagnose Lyme disease or almost anything a woman can be afflicted with. It
Right.
takes
Right.
3 to 7 years of repeated doctor's visits, multiple facilities, multiple specialties to find one that instead of walking out the door at 10 minutes, spend an extra 30 seconds
Yeah.
and put their doctor hat on for a second.
Mhm.
And so it's hard for me to hear, not hard because I get it, the frustration of the doctor, but I also get the frustration of the patient having been one, with a family
Mhm.
where I'm not getting care even when there's a lot of it, even when it's cheap, even when it's inexpensive. It's not like I'm getting the experience of all these great doctors, and when I'm in the room they're giving me great care. So like I don't know how that bridges if we keep on the systems we're in.
Yeah, again, I think it's multifactorial. I think I don't think every new doctor goes into the work field going, "Oh, I'm gonna milk this insurance. I'm gonna bill it," because we weren't taught insurance when we were in training. Most training programs are downtown in the inner city, where their sole job was to learn how to treat the most critical and crucial patients with whatever they have at their disposal. I didn't need to navigate insurance until I really came out and started being an attending physician myself. So I don't think we're molded to learn how to make hospitals profit. I think it's a combination of things, insurance reimbursement. How does insurance companies make money? How are they a $1 billion industry? Well, their job, especially in healthcare, is to decrease reimbursement, right? You don't even need a doctor's hat. You don't even need an administrator hat. You can be the general person with just a high school education and understand the concept of revenue. They they save money by decreasing reimbursement, increasing people to buy into their insurance. Now, if that's the concept with the insurance companies, the hospital's main job is to get reimbursement. So if they know they're fighting for reimbursement, then the only way they can get reimbursed to what they feel like they should be reimbursed at is to charge more, bill more visits, more surgeries, more specialty visits, more specialty appointments, see more patients a day. If the insurance companies build the hospitals at 100% reimbursement, I think that would be a very easy fix, for both patients and providers. Because if I see you and I'm reimbursed at 50% at best, then I'm going to fit two of you into that one spot to at least compensate for that low reimbursement. So I don't think I don't think they finish school thinking how to play the system. I think they're just, if they've been it long enough, if they feel like in the insurance company, in the hospital gives them these incentives to bill more, see more, and they get more of a bonus, sooner or later, they're going to start working towards a numbers game because that's how they get reimbursed.
So let me ask you a question because, I'm sure you've had to access the healthcare system once or twice in your life. And so when you're a patient and you get the bill for an ER visit where doctor walked in, took vitals, ran a lab and left, and then you leave with a bill for $8,000, it's easy for a patient to go, "Yeah, you're getting reimbursed enough." Like, what do you mean 50%? You're telling me you wanted $16,000 for spending 6.5 seconds to tell me, "Oh, honey, you're in pain. Go home. Here, take some leave." Like,
Yeah, totally understandable. But remember, you're only seeing one side of it. That 4 hour ER visit, the hospital gives you that bill. They have to bill 16,000 because they don't anticipate 100% reimbursement from the insurance company. So they don't know how much they're going to get reimbursed right off the bat. So, we do tend to, they do tend to bill higher. However, that same patient, if you go, I'm not paying through my insurance, or I don't have insurance, give me the cash buyout price of my ER visit, you will be very shocked if the hospital goes, oh, he's paying cash, let me adjust your invoice. And they give you a different invoice with a cash buyout of your ER visit. And then you compare that invoice with the invoice to the insurance company. Like I said, it doesn't take a brain surgeon to notice the discrepancy of these two charges, So health systems are playing games, insurance companies are playing games, and frankly, the only people that are left to suffer or carry the burden of this ultimate bigger picture game that they're playing is the patient, So it needs to be changed.
But I had a question for you.
Yeah.
So you'd mentioned a physician shortage. So in that context, like when we think about teachers, there's all kinds of studies that if a teacher has to teach 40 kids, 50 kids, 100 kids in a classroom, that each of those kids is going to get very little from that experience.
Sure.
The teacher's going to be overwhelmed. But again, nobody wants to go into teaching because it's terrible. And so with the physician shortage, are there even enough physicians to do your model of care? Because if your numbers, so like you mentioned, 2,000 patients, I don't know how many patients you would do now, but like, could that even happen? Because I remember a friend of mine needed to go to the ER. It was a smaller hospital. There might have been like 2 doctors back there.
Right.
And there's like 50 people out in the waiting room. There were only 10 rooms. All 10 were used up. So they would bring somebody back there, and then that person would come out with all kinds of like tubes coming out of them because there was no place to put them. It's like, well, go wait in the waiting room with all your vials hanging out and everything.
I've had
And
that
we're
where
like,
they put me in a hallway.
yeah. And it's like, well, is it even possible to do it a different way where it's not just 5 minutes and we got to get you out because there's 49 other people out there we got to get?
Right.
Is it even possible with that physician shortage you mentioned?
Right. That's actually a really, really good question. That's something that, as my business grows, it's gonna haunt me. It's gonna haunt me in my sleep, But the way I look at it now is, which one do I choose? It's the lesser of two evils. For us, there's no good choice. It's either be a mediocre doctor for 2,000 patients, or be a great doctor for 300 to 500. And that's a burden that I have to carry every day when I made this move. Is I didn't go give away the prime of my life to go study, get my degree, and then cut down, the amount of patients I see by, 75%. But I also don't want to feel that I'm not giving the best I can because I'm limited by the health system. I'm limited by insurance. I'm limited by all these factors. So at this place in time, I made the choice to take the leap, and I'll see how it goes. Maybe I'll adjust it. Maybe I'll add insurance coverage later. But what you just mentioned is a huge issue. There is no doubt that this needs to be fixed. At least I'm cutting it down to 500 patients or 300 patients. You also have physicians who are quitting because of just burnout. So we went from 2,000 to 0.
Well, that's the other side of this that I think if there was more adoption of your style of care, maybe more people would be willing to become doctors. Because I know, looking at how my dad lived, how my brother lives, how my brother talks about it, you mentioned the whole concept of the work comes home with you. You go on your computer and my brother does that all the time. Right. I looked at him going, I'm good. I had no interest. And so there is that part of it that you could say we have a physician shortage, but maybe it's because nobody wants to do this.
Oh,
People see it and it's terrible, but if it wasn't terrible, maybe more people would go into it.
well, you hit the nail on the head there, buddy. I mean, I'm hoping more primary care physicians, more specialties who can do this kind of model, um, do leave, because then it really puts the health systems and the insurance companies in a bind and need to come up with almost a mixed kind of model to benefit both the physician, the patient, rather than just solely working on revenue all the time. Revenue, revenue, revenue. Um, it's also a disease at its core because US is only, I think US might be the only country that requires a full 4 years undergraduate before you go into medical school. A lot of places in the world, even where I trained, you go into medical school directly out of high school. Now, some people say, well, you need, you need that 4 years to really grow, really know what you want to do and get that foundation. Well, you're just one country in 100+ countries that do it. How about all the other doctors in the world that are functioning just fine? So you look at the pros and cons of being a physician nowadays. You're leaving undergraduate and medical school with probably 300 to half a million dollars in debt right off the bat, without making a penny. You have signed yourself to $500,000 in debt. If Would you take on that burden when you have zero in your savings, right? No. So that's what you're signing up for. And then the other thing you're signing up for, what they don't tell medical students is, all right, you're full of spry, you're full of energy, but we're gonna knock you down. 4 to 7 years of residency. If I mean 4 years of medical school, we're gonna knock you down. Don't expect to have much of a social life because we really only got 4 years to cram all this knowledge into you. If you're lucky enough, you'll be able to get into residency right away. But because it's so competitive, you might need another 1 to 2 years of extracurricular training or research. So that's 4 to 6 years. Then you go through the most competitive process you ever been in to get into residency, just to get hammered down for another 4 to 7 years, depending on your specialty. So we're looking at an investment of 10 to 12 years of your life. But keep in mind, these are the golden years of anybody's life. These are the age between 20 to 30, where people go out in other fields and really start honing their skill, making a living, advancing their careers, building businesses and empires. And you go, no, you're stuck in a hospital 100 to 120 hours a week for 4
Having a family.
Yeah. So they don't tell you you're giving away your prime, your health, probably because you're probably most healthy during your 20 and 30s. You're giving away that loan, that financial, you're taking on that financial burden. I mean,
You also make peanuts during residency. For
oh yeah,
anybody who doesn't know, you're
per
not going out
hour.
of med school
Yeah,
and
per
making
hour in
200
residency,
grand.
you make less than McDonald's.
Yeah.
Everyone knows that, per hour worked.
Mhm.
And then the hardest part that I feel like needs to be told to medical students pursuing this career is all your other colleagues in other fields, friends in other fields are starting families.
Mhm.
You probably won't, because your work hours and your financial burden, right? So me and my wife, we're both physicians, by the way. We started, our family later in life. Of course, I would have loved to have been like a young 30s dad, but that didn't work out because I was too busy in the hospital. She would have loved to be a young 30s or late 20s mom. That wouldn't work out because of what we signed up for. So, yes, the physician shortage in essence is because of that. You know, if you said all those negatives I just mentioned, but you know what we're going to do as a country? We're going to pay for your education. You don't worry about that $500,000 debt. We're going to pay. You've given up enough. Maybe it'll be
Well,
worth
it's like
it.
a
Mhm.
national investment
Right.
in your education.
Yeah, a lot of countries like India and China, who are leaders in their own medical fields. A lot of European countries have subsidized medical schools because they know they know the shortage is there,
Mhm.
and
But
they
that
pay for
so
students to go to school.
so and and you hear the stuff on the news media, but because we beat the crap out of you guys, because you invest $500,000, and that's the debt, right? So and people don't think of this, and I'm gonna put my economics brain on and my finance brain on.
Right.
It's not just the debt, because that's also lost earning potential,
Oh,
lost savings
100%.
potential during
Yep.
that
Mhm.
time.
Yep.
So it's 12 years you give up, not just having debt poured onto you, but these are all hyper intelligent people. And if you're smart, you go into this. And
Mhm.
you know, I know a lot of people who are like this. Oh yeah, let me go take out a $500,000 loan, make nothing. Let me go to residency, work 120 hours a week, and make nothing. Let me start getting money at 35 if I'm lucky. Now I'm tired. Then let me start my family with
Right.
all of this saddle of debt.
Right.
And you're not making your peak money, but yes, you start making $300,000-400,000 a year if you're at the top of your field
Sure.
in some of those higher specialties, right?
Hmm. Hmm.
But you're so far in the hole in earning potential that if you had left college and gone into business or any one of these other fields, and you're smart and you could get a six-figure job out the gate,
Hmm.
you'd have banked all that. You'd be making money
Yep.
on money at this
Yep.
point.
Yep. So to
And
say
so
that doctors are in it for the money, that's probably the biggest myth out there. Because if I compare my equity, especially now when I don't have a 401k anymore, if I compare my equity with some of my friends who are in different specialties, it's night and day. You know, it's completely night and day. A lot of physicians choose this career because of their passion for helping people, of their passion for the prestige and the lifestyle.
the prestige.
The
Such
prestige. Um,
an
and they lose vision of what they actually gave up and gave in during the whole process.
Well, I think
Um,
at some point you get a little cynical, especially again, it's beating the passion and joy of medicine out of you over
mhm.
that time. So by the time you get out, heck yeah, you're in it for the money. You need it.
Yeah, you need it.
Well,
You're that $500,000 loan is going to start ticking. You know.
also, you've made that whole sacrifice, and then us as patients, just see the whole healthcare system as a total, but
Right.
we're only looking at you as the doctor because you're the one we come in to see.
Oh
You
yeah.
gave us 10 minutes, and we say, "You suck. We
Yeah.
hate you. You
Yeah. No,
don't
for
love
sure.
me. It's all
Yeah,
you."
for sure. For sure. And what I'm trying to say here is, it's not our fault. It really isn't. You know, Um, Now, I'm on my own business. If one day I lose the vision and the mission of why I did this and start cramming in 2,000 patients and giving you 5 minutes, then it's my fault. But 80% of the doctors, 90% of the new graduates join health systems. And then they're all of a sudden set to these qualities, these metrics, these revenue bonuses they have to meet. It's not their fault. It breaks my heart. It really breaks my heart because I think if healthcare profession was transparent and gave medical students or undergraduates like, hey, don't look at the salary of a first year general surgeon out of residency. I want you to look at the loan, the sacrifice, the time, and plus this is what you're going to be expected to do on a daily basis if you join a health system after you finish. I think they're cookie cutter clear. We even be in worse case than we are now with the physician shortage. It's just a lot of that stuff isn't mentioned. And I actually, when I was in residency, when I finished residency, I almost wanted to start a class preparing undergraduates on, look, this is full transparency. This is what you're signing up for. So if you want to have a kid a full family of 4 or 5 in your late 20s or mid 20s, uh, maybe consider choosing something else. Because the last thing with a you know with signing up for something this extent, the last thing you want to do is be blindsided. Um, so it needs to change. The whole concept,
Yeah,
we need to push more doctors out, and there needs to be a way to do that. I just don't know what way.
I think there are ways. One, it depends on the success of your model too. That
Sure.
watching people jump like you, and that you don't drown, that your wife doesn't leave you, that your
Mhm.
kids don't hate you, right?
Mhm.
But,
Right.
right, like, there's a certain amount of that where it's that fear. Now I'm poor and the business doesn't turn out, and I have a wife who's a stay-at-home mom, and I have a lifestyle I have to maintain for not just her. And if you're Asian, and this is very, very common amongst first generation Asians or first generation immigrants, it's not just your nuclear family you're supporting with your
Right.
income. It's
Right.
your
Right.
parents, it's your
Mhm.
cousins, it's your, people back where, countries of origin
Mhm.
that even go back to your parents, right?
Right.
So there's a lot to lose. And so it has to be something of, I I need to see someone succeed at it to believe that I can succeed at it,
Uh-huh.
and think that it's gonna be okay. I think there aren't that many examples. Even when I see people like you who have left, and I've watched it over the last 10 years, there are more. Then they form groups, and
Right.
then the groups get sold to PE, and then
Exactly.
PE changes it. And
Exactly.
and
Yeah.
so,
Exactly.
it the model, it's all, you're all wide-eyed and green-tailed, and it's, doctors without borders for 3 years in your private practice, and then all of a sudden you go, well, I kind of need to make a buck,
Yeah.
and other people join you and you figure out how to make a buck. So it changes. I hear that conversation a lot, especially amongst the doctors that I know, is just seeing is believing, and seeing someone actually do it and succeed at it and have the life, continue to have a reasonable life, maybe not the same life, but a
Hmm.
reasonable life outside of the system.
Yeah. I think you're right. I think we need to show. Doctors aren't stupid. We're smart. I think if I can do it, and I'm not the smartest guy out there, of course you both know that by now. Um, I think if I can do it, any physician can. The hardest part for me was fear. The fear of the unknown. Um, but one of the reasons I did it was because you can be reassured that you're not going to have a lack of patients just because there's not enough doctors. You know,
Right.
supply and demand. Hospitals are picking up physicians as pawns and putting up these non-compete 2-year, 3-year non-compete 30-mile radius stipulations in their contract because they're collecting doctors because they know at the root of their business model is the physician. I just wish more physicians knew that and understand. Hey, if the health systems are willing to pick you up, left and right, I can leave my practice today and walk into the main office of Baptist or UF or Ascensions with my medical degree in hand. They'll give me a job the next week. So
Mm.
really, there's really not an unknown. You're going to have patients. You're in demand, and you have a huge safety net. Why don't you do it? Why don't you take the risk
Well,
and practice medicine the way you want to?
I would agree with you and disagree with you. You would have patience.
Sure.
I have interacted with a lot of doctors that if they weren't in the health system, they're not getting anybody to show up at their shack and shingle shop because they were either rude or dismissive or ignorant or didn't care. And I'll, like, I don't want this to be me beating up you, because again, you're it's the best experience I've ever had. And but the fact that it's so glaring that I know that immediately, like, is disappointing, because I think about my experience as a patient, how relieved I am to have met you at the age I've met you. What would have happened if I had met someone like you in my 20s? What would have happened if I had a doctor or any series of the doctors that I had seen from my 20s and 30s, if any one of them had been like you, and you did it while in the system. I met you while you were working the system. You didn't have to be the way you were in the system. And so I find that when I talk to patients, they're like, well, I went to one idiot doctor after another. Everybody telling me I'm stupid. Everybody telling me that I don't know what's going on in my own body. Everybody telling me, and then that's common. That's not even rare. That's every single day, the doctors that you see. So I don't know that if that's the attitude that when out of 10 doctors I'd seen, and you're the
Right.
only one, that 10 doctors can leave and have a following that went with them. So you'd have to adopt that mentality now within the system.
Right.
You know, I know doctors get peeved about patients bringing in their WebMD search. They do get so peeved. Fuck you and your WebMD, right? They get so mad. They have all the signs in their little offices and they get so mad. But hell, like, I get why patients bring their WebMD search because they went to 6 other guys
Right.
that dismiss them. They're like, I just want answers. I had to do the research on my own. This is your job. You
Right.
should have done the research. But you know, you're not using the fancy degree you got and the 12 years of training you got. So now
Right.
I have to fight for it. So
And
I get
feeling
that
like
frustration.
you have to have an equal education just to communicate with your doctor in the 5 minutes you get. It's like
Right.
if I'm not clear, if I don't use fancy medical terms, are they even understand what it is I'm saying? So I then feel like, well, I got to do my own research, and then I got to say medical terms, because if I just say my stomach hurts, that
Yeah,
doesn't have a
now
lot of meaning. And then they're like, that's not even where your stomach is. That's actually your liver. And I go, well, I don't know.
yeah, none of us regular folks want to know what syncope is. But
Right.
damn it, now I gotta research.
Right. Right. Um, Dr. Google has definitely become the norm these days. And again, it's not the patient's fault. You're pushed to advocate for yourselves because you feel like the healthcare system is not advocating for you, because you feel like your doctor isn't advocating for you. You like you said, you have 5 minutes. You better be as smart as you can in that 5 minutes and get your questions answered. Um, I personally love it. I love it, love it, love it when a patient comes prepared, because whether you're prepared correctly or incorrectly, just by reading, just by thinking, you have already built the foundation for me to have an easier time having a discussion with you, right? So, but my patients get 30 minutes to an hour of undivided attention. We can do that. We can take your Dr. Google list or WebMD list and go over every single part of your concern and really get to the root cause of your illness so you never do it again. So if you printed that list once and you came into my office and we went through everything and you left out feeling, well, that was a waste of time, me having to do all that research. Next time I'm just going to come in and tell them what's on my mind and tell them how I'm feeling. Then you'll never do it again. But we're in the atmosphere where I have to tell patients, especially in the old model, you're your own advocate. You know, if a doctor can get you out of there in 5 minutes, he's going to get you out of there in 5 minutes. You stand your ground and you say, I'm sorry, my appointment slot was for 15, 20 minutes, and I've only been here for 3. What is going on? And, you know, I had 3 issues that I wanted to talk to you about. You only covered one. Why aren't you covering my other ones? And if you feel like you get an answer that is not satisfactory, you're the patient. You're the business. You're the customer. You have the right to go and find someone, read reviews, talk to your friends, talk to your family. I agree with you, Chattel, everything you said. Not all doctors are made the same. You've had 10 bad experiences. But chances are, if you talk to someone that knew one good experience, that's better than nothing. You can go over there. The problem now is healthcare systems, with collecting physicians into their system, have taken that concept away from patients. Patients themselves right now don't feel like customers anymore. Like you go car shopping. I don't like the way your agent talked to me. I'm going to go to Honda down the road and do it. Now, because there's a lack of physicians and every physician is with a healthcare system, patients have lost a mentality that we wouldn't exist if it wasn't for you guys. To the point where, oh, I don't know if I should call the on-call line. I don't know if I should bother him and see if they can fit me in because I'm just going to get yelled at. Like, take the ownership. Wear that cap. Wear the cap where I'm the customer. If I was at Walmart and complained even for 5 seconds, they would have given me a full refund, right? And fight for your right to be seen by the person you want to be seen. It's very critical, especially nowadays when there's such few doctors. There's more mid-levels, PAs, nurse practitioners. You might not even get to see your own doctor in a whole year, even though you went to the office 6, 7 times. So really, really advocate for yourself. Learn, go on Dr. Google, go on WebMD, educate yourself, because unfortunately at this time you're your only advocate. Unless you join a practice of like mine,
Yeah.
find a concierge, find a direct primary care. Chantel, I push you out of my room. Like you push to leave my room. You're like, I don't want to spend another 10 minutes. You already answered everything. Stop. I got stuff to do. So either find that kind of practice if you can't afford it, or if you're going to traditional route, be your own advocate. Advocate for your time, advocate for your questions. That's
Yeah, and I would say sometimes that's easier said than done because you're pushed
yeah.
into health insurances that say, "Oh," like, and I experienced this where we live, where we're not in a big metro, right? Like, you go 30 miles north of where we live, you're in big metro. There's a lot more doctors there, there's more hospitals there. Here, I live in the boondocks and it's 30 minutes to go anywhere. And so when you get insurance, one, there's only two insurances that cover anybody where I live. And then when I choose an insurance, it's only this place.
Right.
And this is only the
Mhm.
specialist. And this is all we're covering because you're in the system. And we tell you what group of doctors you can have. And you go to that practice and they have two doctors.
Right.
Now, and I was fortunate they had the two because one was you and one was somebody else. And I went to the somebody else and I had a horrible experience. And I think I randomly had you for
Yeah, I
my
think it
son's.
was like an urgent visit or something.
Yeah, you were
Yeah.
covering. And it was
Yeah.
for my son, like he had a cold or something. I brought him in, and you were so personable and so nice that even though you weren't even treating me, I knew that the next time I made an appointment, it was going to be with you. Yeah, and I had to tell them because you weren't listed as my primary. They're like, but that's not your person. And do you want to switch over to? They don't make it easy, even for my son and
No.
his
No.
his primary. There's a practice with 3 or 4 doctors there, and I guess when insurance switches over, doctors get dropped out of the system,
Right.
and so now
Right.
you
Right.
can't even, and without a declared primary, they can't bill. So now they're charging you out of pocket. It's a whole.
Mhm.
They don't make it easy to choose a doctor. Once you're in the system, once you've chosen a health insurance, you get the doctors they give you because if you go out of the system, you're paying out of pocket. And
Right.
you and I had an interesting conversation before, and you were like, "So pay out of pocket." And I'm like, "I don't have $600. I don't have $1,000." And he's like, "Trust me, if you tell them you're going to pay out of pocket, they're not going to charge you $600." And I'd like you to tell, our listener, which is probably already dropped off by now. Like, what do you mean by that? Because that was like mind-blowing information to me.
Right. So, I'll use the example of getting an MRI. Okay. So if you came in here, you screwed up your shoulder, and I'm like, you probably need an MRI. I have, as a doctor, I have two paths I can take. One is choosing the insurance route, or two, choosing to treat you, which I think is the right route, is, based on the non-insurance route. So the insurance route, I know you need an MRI. You know you need an MRI because I don't think you broke a bone. I want to see ligament. I want to see muscular. I want to see nerve. I want to see ligament damage. X-ray isn't going to show me that. So I would have, if I go through the insurance route, I would have to send you. I can't order an MRI. If I order an MRI with our first visit, they're going to deny it. And then I have to say, okay, you denied it. What do you want me to do? Insurance will say, well, I think we should do an X-ray, which I already know won't show me crap. I'm sorry. Am I allowed to use that language?
Yeah. Oh, I curse all the time on here.
Okay.
Yeah.
Won't show me anything that I need to see.
This is an R-rated show. Okay.
Okay, good. Then maybe I should step it up a level. Really let out my frustration. But I could order. I would have to order an X-ray, which I know won't do any good because I know you didn't break your arm. And then I would have to send you to physical therapy, and it would only be a physical therapist that your insurance covers, which sometimes are like 30 minutes away. And then your question is like, "Oh, is physical therapy covered?" And I go, "Yeah, your insurance might cover it, but you might need to pay a copay." And then how many times do I need to go see them? And I say, depends on the physical therapist and depends on your insurance. Usually like 4 to 8 times, $50 copay, 4 to 8, 10 times, $500 out of your own pocket. And this is 2 months later, which we still know at that time you need an MRI. And then they will let me order an MRI. So then I order an MRI through insurance. You go to the radiologist, and then you get that bill back. And that bill back, you're like, oh, why am I still charged $500 or $300? And you look at the invoice and it's because the radiologist charged the insurance $4,000 and they paid 95% of it. But you're still stuck with a $300 to $500 bill. So that was the insurance route. 2 months later, probably $1,000 later with the copays for physical therapy and your MRI copay. Versus my route right now would be like, I'm going to send you next door. I'm going to write on this order that you're cash pay, and they're going to get you in today, and they're going to charge you $200 and change for the same MRI today. So even with your insurance coverage, the hoops that you had to jump through, you still wound up paying 4 times that amount. It had to wait 2 months before we could get to the bottom of what happened. So that's insurance in a nutshell. You have insurance. Your insurance main goal is to not reimburse. And then, so the health systems have to play and say, okay, if you're not going to reimburse, then we're going to charge this person $4,000, knowing that you may reimburse us for this one, but knowing the next person you might not reimburse us. Do you get it?
Yeah.
So it's like you're just pawn in the system. So my patients now, they pay a monthly fee, totally transparent. I think it's affordable. I don't know about you guys, but I use it. They pay a monthly fee, and that's all they have to worry about. They don't worry about visiting me 30 times in a month. They don't worry about copays for every other visit. They can reach me 24/7. My patients now unanimously feel they get better healthcare with me in my practice than they ever did with insurance, and probably would never go back. And that should speak monumentally about how hard it is to navigate. Basically what you said.
I wondered about that though, because I was like, why would insurance spend $3,500 more than is needed, or why would the hospital give up that $3,500? And if it's because most of the time the insurance isn't paying it,
exactly,
then it starts to make sense. Otherwise, we as patients thought that like it's just being paid all the time. And
no, Absolutely not. That's why you go to an ER visit with insurance and you get a $16,000 bill like you did, versus you just asking them, I don't want to utilize my insurance. I haven't met my deductible anyways. Just give me the cash pay pricing, and you get something 1/8 the price.
Mm-hmm.
Because that 1/8 the price in the pocket is better than 6 months for the hospital begging for money from the insurance company, and still might not even get 1/8 of the reimbursement. You get it? So
That's very fascinating because yeah, like a lot of my friends, the deductible that they have is anywhere from $4,000 to $8,000.
yeah,
And
yeah,
in the insurance policy, like they had me read it, and it goes, "We will not even exist for you
Until you pay the
until
deductible.
you've
I
paid."
don't even
Like,
understand insurance
don't
policies like that.
don't pretend we exist. We don't exist until then.
yeah.
And I'm like, what? Then why do I have you? What do you mean? I don't
And-
expect to have 4,000 to 8,000 in costs this year.
And think about
Right.
it. It's $4,000 to $8,000 in deductible. They don't cover anything until you meet your deductible, and you're still paying $400 a month.
Yeah.
And if you're lucky,
Yeah.
you have corporate insurance through your employer where they're paying 50% or 75%. For the
right.
lucky few, 100%, right?
Mhm.
For you, but not your family. But it's age rated and then by number of people.
Right.
You could be paying $2,000 a month for insurance that you
Mhm.
can't even use. And they say, well, preventative is free. You can go to a primary care and your preventative is free.
It's part of the membership here. I mean, it's
But if you're sick, guess what? They don't bill it
That's
under
what-
preventative.
That's
Yeah.
one visit
Yeah.
too. Like that's one
exactly
one free visit. And hope
One
you
free
don't
visit.
actually get anything found because
Exactly.
then
And
welcome to your
it,
deductible.
it rolls over every year. So like when you get
Yeah.
close to meeting it, but it's in November, you're screwed because it rolled over. And you
I've
start
had to
from
tell my
zero.
friends, I'm like, it's October, it's November. I'm like, look, if you need any surgeries, you probably should just get that done today, right? Like,
Right.
just call up your doctor and be like, look, I really need, I've met my deductible, or I'm like within a few hundred. You got any like $30,000 surgeries so we could
Right.
schedule
Right.
this year?
Right. Yeah. They're selling fear.
But does that work for surgeries too? Like, okay, I get an MRI. And even with the MRI, I'm still like skeptical. Like, I need to try this.
Uh-huh.
Not that I want to break my shoulder or anything. Like, I'm wondering, is this true? But like, let's say it's a surgery, right? Like, let's say, and I'll give an example for me. I've had appendicitis.
Right.
My son needs to probably have his tonsils out. Can I go to a surgeon and say, hey, I'm going to pay cash? Are they going to charge me 50 grand? Like, because,
No.
if insurance is going to
No.
pay them 50 grand, why would they take my surgery?
In short, so that's a great question. Any health system who takes insurance is not a sure thing. You get
Mhm.
it? And
Yeah.
they're going to charge the insurance 50,000 for the surgery. Then does that mean they're going to get reimbursed 50,000? Absolutely not. The insurance company, based on the price of the surgery, if it's warranted, will send an auditing team and do the whole audit and pick out everything. And out of that $50,000 bill, they might get half of it. They might get even a little less. So you'd be very shocked if you say you need an elective surgery. Now I'm saying if you have full blown appendicitis, don't shop around. Go straight to the ER, get it out, get it taken care of. But if you need knee replacement, if you need tonsillectomy, getting your tonsils out, if you need adenoids taken out, if you need your deviated septum repaired, go call around. Go to see some specialists and say, hey, before we go any further, I want you to know I'll be paying cash out of pocket. Can we work out a deal? 9 out of 10 times they're gonna say, oh, you're gonna be paying cash? They're gonna give you a deal for it because they know $10,000 in hand today is better for their business than charging insurance 20,000, of which they might get some of it or half of it, but it's going to take an average of 6 months to 12 months to get reimbursed. Right? Cash is king for a reason, and still exists in healthcare.
Right, and you say $10,000. I don't know very many people who got 10 grand laying around, and so they
Sure,
say, okay, well, I'll pay $500 for my insurance,
sure.
and then if I need this, then that's why I
Right.
have insurance, because I don't have 10 grand.
Right. Well, that's just an example.
Right,
You
yeah.
know, there's a lot of common surgeries which I think our surgeons would do for a couple thousand versus what they charge insurance. I'm just saying you are definitely in much more room to negotiate paying cash. Now, keep in mind that 10,000, you have a $6,000 deductible. Like
Mhm.
you're gonna be paying 6 grand irregardless. But if you go to that surgeon who's gonna do this procedure for 10,000 through insurance, and you say I'm paying cash, he might say, "Oh, you're paying cash, then 3,000. We'll do it next week, in 2 weeks." You're
Y-
spending that money irregardless. You won't.
So, so let me ask you then, to use a real life example. So I had broken my finger. This was like 7 years ago or whatever, and I went to get surgery, and I saw the bill that they charged my insurance, and it was like $35,000. And I went to my dad, and I'm like, hey, this surgery was $35,000. Like, that's crazy. And he's like, what? No. What do you mean 35,000? I'm like, well, the insurance paid it. It's not a problem. But he's like, there's no way a surgery on a finger is $35,000. Like, what do you mean? And I was like, no,
Mm,
look at the paper. Like, this is 35. It says it right here.
yeah,
And I wondered, I was like, well, I would never be able to pay $35,000. So
sure.
but what is a finger surgery? Like, what would that usually cost? Cash, paying cash.
But
That kind of concept.
right. Depending on the surgery, I don't. I would. I'd be very shocked if it was $35,000 for your finger. But this is how healthcare is.
It's
I
almost
buy
like
a
a monster feeding itself, meaning like the whole point is to have lower healthcare costs. But because of all the games we have to play in order to access it, pharmaceutical games that they have to play to get on formulary, games insurance has to play in order to quote unquote keep costs down, games that doctors and health practices have to play just to get some of the money, because we think
right.
they're making bank. We think, oh, 35 grand
Hmm.
for finger surgery. You guys
Absolutely
are
not.
making billions of dollars.
Well, you're looking at that one case, right?
Right.
You of all people know you gotta look at the big picture. If I'm a huge health system, and historically, Aetna, Blue Cross Blue Shield, United Healthcare reimburses me about 30%. Well, I'm gonna upcharge 70%. I'm gonna upcharge 100%.
Hmm.
Right? I have to, because if I'm getting reimbursed at 30%, I have to increase what I'm selling, whether it's ethically right or wrong. So one Tylenol in my office, as a member, you get it for free. Okay. But if you with the same Tylenol, one pill of Tylenol in the ER is like 10, 20 times the cost. It's the same medicine. But they have to inflate their cost knowing they're not going to get reimbursed at 100%. Now, if insurance companies get reimbursed at 100%, reimburses physicians, offices, health systems at 100%, morally, I'm hoping that would fix the issue, but I don't know.
Well, and that's the thing,
That,
is maybe it's not a
that's
percentage, because I
crazy.
think about this, like, I'll give you an example from my real life. That I was in healthcare for a long time. We were not allowed to tell our patients the cash price.
Right,
We
right.
were not allowed to tell them. They
What?
had to go through insurance. They had, if their copay was $20 and I could have given it cash for $3, say,
Hmm.
why are you even running this through insurance? You're paying
What?
$20. It I could and still make money. We're talking about cheap medicine.
Right,
We were penalized if we told them the cash price. And so you go, well, why didn't you just tell them under the table? They go and audit all of the
right,
medications we bill. And
right,
so for a lot of these like maintenance medications that are for hypertension, cholesterol, a lot of them are insanely cheap. And
right.
so But if we're not billing it through insurance, now you're not compliant. Now you're not adherent.
Right.
They don't
Right.
see the billing. The patient is not getting meds. The doctor gets penalized
Right.
because
Right.
they need to see it billed through in their system.
Right.
And so you have to pay. Otherwise, everybody gets penalized in the system.
Right.
And so you're artificially creating a higher price for something that shouldn't cost. And it's the same thing. We know this about diabetes medication. It's
Yeah.
cheap to manufacture. Now
Right.
take the opposite. Let's say you have a high touch medicine.
Uh-huh.
HIV meds
Right.
or
Right.
infusion meds. They're very expensive. They're brand name. There's only one. You have to buy the brand. There's no generic. It's not cheap.
Uh-huh.
And what we were finding is that we would get, file the claim for reimbursement on a specialty med, a brand, and they would pay less than what the drug cost for us to procure it.
Right.
So when you paid your $20 copay, understand that your pharmacist, if they were independent practice, or your pharmacy, if they weren't Optum or CVS, whatever they
Mhm.
were, paid for you to get that medication.
Right.
They did.
Yeah.
When we were treating HIV, when we were treating some of these brand name drugs, we used to hate it, but we are required to dispense it, and we wanted to because we want to help people feel better.
Uh-huh.
But if it was $500, we got paid $300. Your pharmacy paid $200 for you to get that med.
Yeah.
And so none of that makes any sense. And again, it's all because of games. And so when we see the price of healthcare going up and up and up and up, it is because of the games. The games are
Mhm.
not actually lowering the cost of healthcare. It's not
No.
making better care either. And we sit here and we tolerate it because we think that it is fear. We think that
Mhm.
if we don't have insurance and we don't have the system, everyone's going to develop Munchausen's and everyone. No, am I wrong? That's the thing. Like, we're
Yeah.
all gonna go think we have colon cancer and run to the doctor every 16 minutes, and we're gonna overutilize care if we don't have this. And if we don't have insurance, we're all gonna go bankrupt. But yet I know so many people with insurance still needing to
Right.
go on Kickstarter or crowdfunding sources
Right.
to pay
Right.
for healthcare. They have
Well, to
insurance.
be
They
fair,
still need it.
to be fair, I was on WebMD earlier, and I'm pretty sure I got full body cancer.
Yes,
Well, the thing, so even though you feel that way, I just want to let you know you can get a full body MRI cash much cheaper than getting it even considered approved through insurance. Okay,
and
I agree with you 100%. I think there's a lot of games being played. It's one of the reasons why I left. I think the only people who suffer are patients and physicians.
I would say physicians and
You know?
practitioners, because I see
Yeah.
it with the NPs, I see it with the PAs too, and I see it with everybody in the system getting squeezed.
Yeah.
And there really is only a few people not getting squeezed, and none of them have health care as anybody's best in their interest whatsoever.
Right. Right. Yeah. I agree with you wholeheartedly. Best thing you can do is, I'm very grateful you guys you followed me and you guys continue with me. The best thing I recommend is educate yourself. Go out, see what other types of practices there are, especially for primary. Um, and see,
I think people are scared with that, and not to interrupt you, and by the way, you'll know that I'm gonna do that. Can't stop it. But you said it earlier, like concierge, and you're kind of like a concierge primary care. When I hear those words, I think expensive. I think it's for wealthy people. I think it's for only rich people can afford to have a doctor like you. And um, I'm not rich by any means. And you and I had this joke in your office. I'm like, dude, you're poor. Anybody who can lose their whole livelihood by getting sick for a month is broke.
yeah,
So like, you're
Mhm.
broke, I'm broke, my brother's broke. So, but yet, because of the care I've gotten from you is so much better than I've ever had. I followed you, and I will say it's not expensive. It is significantly cheaper than insurance and I am paying for insurance,
uh-huh.
but it was cheaper than Medicare. Like, no joke.
Yeah, yeah. It's about you know my location. You know where I'm at. I've had business advisors tell me I'm charging much less than I should be charging based on the location and stuff like that. But at the end of the day, I still stick to what I told my wife, that I make the same exact salary doing this on my own with full autonomy, working a little harder. I'm still going to choose this. So I was never in it for the money. I know how much I need to, have, financial stability. And there's been numerous publications out there to say, once you meet a certain threshold, the higher you go, actually it decreases your quality of life,
Mhm.
you know? So I think I found where that is for me and my family. My job is to fall in love with medicine again. Really, that's why I did it. I wanted to fall in love with medicine. I wanted to take my relationship with my patients to a whole new level. And I really want to focus on providing the best care I can for my patients now that I'm out of that system. I mean, I hope my mission never changes. And that's why, when you say group practice, a lot of private practices make groups and then wind up selling to a health system. I mean, I have a pretty well written into contract that that's not a route that we're going to take as this practice. That our foundation at its core will always be the mission of what it once began. Um, I think as long as I stay the course, I'll be fine.
So
But yeah,
I
it's
would
it's
say,
not
yeah,
pricey. It's not pricey. Yeah, I mean, if you're in downtown Chicago catering only to CEOs of Fortune 500 companies, fine. Yes, nobody can. I can't afford that. If you're Mayo Clinic with their medallion program, that fly families from
yeah.
nationally and internationally to get their checkups. I'm sorry, I'm not that practice. So but a lot of direct primary care, a lot of these, partial concierge practices, they're shockingly affordable. With YouTube, like TV being $80 a month plus the NFL ticket being like another $100 a month, like it's a no-brainer. If you're gonna invest something, if you're gonna subscribe to a monthly subscription for anything to better your life, a private doctor should be number one on your priority because the quality of treatment you get is drastically different than going into the traditional healthcare. And it's not the doctor's fault in these health systems. It's what they have to work with, you know.
Yeah, I get that. And so we, to kind of close up the show, I will say it's not expensive in relation to what I'm already paying. If I compare out, not even apples to apples, but if I say comparing to what I was spending on healthcare already, and what was coming out of my bank account for premiums, for co-pays, for co-insurance already. It it's not that it doesn't reach that level of expensive. And at worst, it's comparable, and I get so much better care. And I'm not here to inflate Dr. D's head. I get nothing. He's paid me nothing. Um, but I'm a fierce advocate of people when I believe in people. And when you have an experience like I had and I'm fortunate to have, um, I want what's best for me. I want what's best for Dr. D. I want what's best for his patients. So why wouldn't I shout it from the rooftops that this model works? It has worked for me. I feel so much better. And he and I had that conversation. All I wanted was to feel better. I'm like, if you can help me feel better, I'll follow you anywhere. And it was a few months where we were working together to help me feel better. And I do. And I thank him for that. And part of that reason, and I want to tell everybody this, being a woman, being Asian, being a person of color, walking into a doctor's office already puts me on a back foot because immediately the doctor wants to treat my womanness before he wants to treat anything else. He wants to treat my hysteria, or she, and I've had the same experience with women too, wants to treat my hysteria before they want to treat anything else. And at that point, I'm still fat. I was like, you know, they got to treat, and first you go, woman, crazy, fat. And then you go, okay, birth control pills, antidepressants, Ozempic, and then you raise the roof and mic drop, you're out of the office. You didn't have to do anything. and the girl's left sitting there going, but my arm's broken. And you're like, but you really should lose a few pounds. Like, that's really what you wouldn't have broken your arm if you were 20 pounds less heavy. And
that sounds like depression to me.
Yeah, it really does. You seem really sad. Maybe you need an antipsychotic because you seem really upset about this broken arm of yours. And so,
right?
for the first time ever, I walked into a doctor's office fully in my woman crazy fatness. And he looked at me and goes, I'm going to treat you as a person. I'm going to listen to you like you're a person. I'm going to care about you like I would care about myself or my own kids or my own wife. And I didn't even know how to handle that kind of treatment. And so I would say if doctors like you exist more and more out there, and doctors like you go out on their own, or doctors like you even exist in the system, they do. To anybody listening, they exist. I found one. He's here. He's talking to you. And you can advocate for yourself and go find them. Don't give up on the bad because you've had so many bad experiences. There are doctors like this, and you can find them.
Yeah, I totally agree. I really appreciate, you boosting my ego even a little more than it needs to be boosted. I'm really happy that we all found each other. It saddens me that the experiences prior to me weren't that good, but it saddens me more that that's the general consensus I'm getting these days, the general feedback I'm getting from patients that join the practice. I don't think, like I said, I think we all went to school to try to do the right thing. I just think the atmosphere is setting up a lot of doctors up for failure and being jaded and being burned out and being tired. That's no excuse. I do feel honored to be in a profession where you, as my patients, can provide me with so much trust. So it's not a really excuse to have these bad experiences, but I do hope healthcare does change and head in the right directions. More doctors move out and seek what joy and why they initially chose this very hard, tumultuous path in the first place. But as a patient, the best thing you can do is advocate for yourself. Don't feel like it's David and Goliath. Don't feel like the health systems are so big and hard to navigate that you're insignificant. A patient is a patient is a patient, which equals a customer. You're the customer. Read reviews, ask around, find a doctor that you click with. Because if there's one investment that you should ever put money in, is your health, nothing else. As someone who does have health issues for themselves, I can assure you everything in the world doesn't matter if you don't have your health. Your business, your family, your friends, nothing matters when your health starts deteriorating downhill. So really, new year 2025, focus on your health. Doesn't have to be with me, but find someone you click with.
Yeah, and it can't be with him because he's full. He has no more room.
Stop it. That's not true. We've been more than happy. We've only been open for 2.5 months, but we are definitely getting up there, which is good because patients are advocating finally for themselves. But yeah, just wherever
He
you
knows
live.
the rule. He's not full, but he knows he has to take me. He can't. He can't kick me out.
I think this is written into the contract as part of this podcast.
Yeah,
anyway. So.
It is. I still pay the bill. Like I said, I don't get this for free. He's still going to charge me next month. But as long as he doesn't say, "Sorry, I'm big shot now. Don't have time for your craziness." I'll be all right.
I hope I never get there. I hope you'll be there not only as a patient but as a friend, as someone who has an administrative background, to tell me when I'm kind of going off my path. And this is the same for my office manager, for my wife, for my patients. Is if you feel the day has come where I'm kind of leaning away from the mission, you guys got to let me know.
Yep. And one day you'll be able to afford us being able to do that for you.
Yeah, wonderful. That's my number one goal.
Well, to anybody who's managed to make it through the hour and a half, I hope you learned something. I learned something, and I've taken a lot away from this conversation. We have a lot to do to help the healthcare system and help ourselves. I want to thank Dr. D for taking the time out away from his patients to talk to us about that. And I want to thank anybody for listening.
Awesome. Thank you guys for inviting me.
Oh, it was a pleasure to have you.
Thanks for hanging out with us today. If you love this episode, or if you at least didn't hate it, don't forget to hit that subscribe button so you never miss what's coming next. And hey, share it with your friends, share it with your family. Until next time, stay bold, stay real, peace out, deuces, and keep speaking your mind. See you soon.